Tonight, the air ambulance is scrambled to help a mountain biker with serious head injuries.
He's all connected, oxygen's on, fluids are up.
I'm happy if you are, yeah.
A man has a life-threatening seizure.
Right, we're going to go off to sleep. Time is 5:26. Ketamine is going in now.
A 96-year-old woman is critically ill.
Sounds like a chest sepsis.
How you feeling now, Ada? OK, chick, you're so tired out, aren't you?
And a man is bleeding heavily from a head wound.
You're still bleeding quite briskly from the back. We're worried that there might be a break in the bone at the back of your head.
We're ready, aren't we? We've got everything. Drugs are in there, blood is in there.
Yeah.
So should we go now?
I think so.
Yeah? All right.
It's early evening in the West Midlands, and while most people are leaving work for the day, Dr. Richard Brown and critical care paramedic Kerry Hemus are setting out on shift.
It was a nice night, isn't it?
Yes.
Nice beer garden, even tonight, wasn't it?
For the next 12 hours, they'll be responding to the most serious medical emergencies across the region.
Ambulance service, is the patient breathing?
Is he breathing? He's not, he doesn't like to breathe in.
Yeah, he's not breathing.
They're having to assist his breathing, otherwise he stops breathing.
So what's happened?
He basically went over the handlebars on his mountain bike. He's landed on his head, his face.
He's landed on his head, okay. Is he conscious?
He's not conscious, no.
Okay. We're coming as quickly as we can.
With the man unconscious and struggling to breathe, this is a Category 1 emergency, the highest priority.
No, go ahead.
An ambulance, the air ambulance, and the critical care team have been dispatched.
Hello, thank you. The job came through as a 37-year-old male. He's a mountain biker. He's gone up onto a jump, gone over the handlebars and landed on his head. His GCS thickened slightly. He was very agitated. Colette and Katie responded to a medic page and they are on scene with the patient.
The injured man is in a remote forest location. Two critical care doctors, who also volunteer for the Mercia Accident Response Service, have also gone to help.
There's a patient who sounds like they require an anaesthetic down in the Hereford area, and two of the doctors that actually work for us are down there at the moment and responding to it in their own car. So they'll initiate the treatment and probably give the anaesthetic, but obviously the patient then needs to be transferred up to Birmingham to QE. See where it is, because often down there is close to fly to Bristol.
A serious traumatic head injury could cause anything from a fractured skull and seizures to a life-threatening bleed on the brain, requiring immediate emergency surgery.
All clear ahead and taking off.
So Helimed 06 from Cosford has also been scrambled.
Who's on 6 today, out of interest?
Jules and Becky.
Got my FFP3 mask and helmet, which I happen to have with me. Then in theory, I could jump on and fly the patient with the 6 crew.
Brilliant, that's great, thank you.
Dr. Richard and Kerry are now only a few minutes away, but fast A roads have been replaced by narrow country lanes.
Here we go. Take it steady down here then. It really is in the middle of nowhere, isn't it?
It's right next to the big kind of wood. Obviously, it's been mountain bike and there's been some trails out here. There we are. Hi, that's on 8 on scene, over.
When they arrive, an ambulance crew and the Helimed team are already on scene treating the patient, along with critical care doctor Katie White.
The injury's top to toe. He's got obvious head injury, facial injury. He's got bruising around both eyes and laceration across his chin, query fracture of mandible. No obvious chest injury. His GCS pre-RSI was 12, but very agitated with it.
Okay, I'm just writing it down here. Great.
The mountain biker was in a very agitated state, which indicates he may have a serious brain injury. He's now been put into an induced coma to prevent further damage to his brain.
So I'm going to jump on the aircraft and fly the patient, because I'm we work on the aircraft. So that just means we can get him to hospital quicker, get the treatment he needs, basically.
Nice and steady.
At night, when the helicopter can't fly, Merit, a dedicated doctor-led emergency response car, takes over. They typically respond to some of the most serious trauma cases, such as stabbings, shootings, and road traffic collisions.
That van's a mess, isn't it?
So it's a femur, isn't it? Yeah, it's a femur. Okay. Flush that through.
The doctor is qualified to perform out-of-hospital anaesthesia and surgery, providing immediate life-saving care to those who need it most.
Okay, you've got the bougie? I've got the bougie. I've got the tube.
That's 100.
On shift this evening, a critical care paramedic Ian Locke and Dr. Andy Owen.
I've been doing pre-hospital in this region for about 12 years, but I've only come to the Merit team in the last 2 years. And I now do this in the air ambulance because it gives me a different group of people to work with and a broader range of areas and jobs to go to.
Ambulance services, patient breathing.
He is, yes.
And is he conscious?
He is. He's my, no, well, partly. He's my son. He's gone into a series of fits. He's had 2.
So is he having a fit at the moment?
He is, actually, yes. He is.
And how old is he?
He's 42.
Okay. Is he, like, shaking at the moment?
Yes, he is, yeah.
I'm going to stay on the phone with you until the crew get there, okay?
Okay.
An ambulance crew reaches the patient within minutes. When they're unable to get the man's seizure under control, Dr. Andy and Ian are dispatched.
We've been sent to a 42-year-old who is apparently still fitting after an hour. It is potentially risky to be in a prolonged state where you're fitting. We call that status epilepticus, and we try and control it as quickly as possible.
A prolonged epileptic seizure can result in permanent brain damage or even death. It's a medical emergency requiring the advanced life-saving skills of Dr. Andy and Ian.
What we can offer above and beyond the standard paramedic crew is providing anaesthetic and putting the patient off to sleep and controlling their breathing, keep the brain happy by oxygenating it well and get them off to hospital where we can look for potentially reversible causes of the seizure.
Just ahead, take exit.
By the time Dr. Andy and Ian arrive at the address,
On the back of that ambulance. On the back of the truck, isn't it?
2 ambulance crews are already there and have managed to get the patient into the back of one of the ambulances.
Go and say hello to him and see what's going on.
Hi, you all right? Andy, how you doing?
42-year-old Tim is epileptic. His father was woken up by the sound of his son fitting. When he couldn't rouse him, he rang 999.
Tim? Any response at all?
No.
Dr. Andy is given an update by the ambulance crew.
It's been about 3 hours on and off, total about 3 fits altogether. He's been fitting well as far as we know. Last time seizure was roughly 4 weeks ago. He's had buckle, he's had IV, and we're just throwing up the 3rd IV because he's had the last one more than 25 minutes ago and more than 15 from hospital. He's been tachy throughout, between 150, 140, BM's 10.5. So that's the best we've had of 90. He's got bilateral MPA and an LPA in.
Fine, so we'll get our stuff ready. We'll probably put him off to sleep.
Thank you.
Despite being given anti-seizure drugs, Tim is still fitting, and the oxygen saturation levels in his blood are critically low.
So, young chap, still fitting. Probably about an hour and 40 minutes. Something's worth of fitting now.
Dr. Andy decides to anaesthetise or RSI Tim in order to stabilise him and then work on improving his oxygen levels en route. Tim's dad is growing increasingly concerned about his son.
No, he's still fitting at the minute, sir. So what we're going to do is we're going to give him an anaesthetic. Okay, so we're going to knock him out, which will hopefully stop him fitting and means we can get a better control of his breathing and everything.
Good.
Okay, sir. All right.
I'll go over.
Okay, yeah, get back in the warm. We'll come and have a chat when we're all done and go from there. All right. Take care now.
Thanks, chaps.
No worries.
Doing a great job.
To stop Tim fitting, Dr. Andy and Ian will put him under a general anaesthetic. It's a procedure which, outside of a hospital setting, only the critical care team with a qualified doctor can perform.
Can you chuck me a 20mm and a 10mm syringe, please? Cheers, thanks.
Ian is responsible for optimising Tim's oxygen levels using a bag valve mask before Dr. Andy administers the anaesthetic drugs.
I'm going to get Molly to come in and be my airway assistant.
Once anaesthetised, Ian will insert a tube down Tim's throat to keep his airway open and allow his breathing to be assisted with a ventilator.
So, Molly, you're going to pass me that.
Yeah.
You're going to hold it. When I'm happy and I put it through, you'll feed that over the top.
Cool.
You'll keep hold of it until we swap.
Yeah.
Right, I'm ready with the drugs. We're good to go. Should we just quickly go through what we're going to do then?
Yeah.
We're going to do an RSI. Estimated weight for this chap is probably in the region of 70, 80 kilos, isn't it? We're going to give him ketamine and rock. I'll give him 80 of ketamine and 80 of rock.
Yep.
Give it a nice good flush through this cannula here, OK? I'll keep an eye on the monitor after that, and we'll count down from there. Everyone happy with the plan?
Yeah.
Any questions, any comments? Right, we're going to go off to sleep. Time is 5:26. Ketamine is going in now.
Dr. Andy has prepared 1 dose of ketamine, an anaesthetic drug, and 1 of rocuronium bromide, a muscle relaxant which makes intubation possible.
80 of ketamine, 80 of rock, and flush.
So if you just try some little bagging for me, just...
Right, so that's 84.
In Cannock, Dr. Andy Owen and critical care paramedic Ian Locke are putting 42-year-old Tim under a general anaesthetic.
Right, let's have a look.
He's been suffering near-continuous epileptic seizures for more than 3 hours now, and his oxygen levels are very low.
We've got a good radial pulse. I'm happy with the blood pressure. Any chest rise when you're doing that?
A little bit, yeah.
So that's holding at 82. Have a look whenever you're happy.
Satisfied that Tim is anaesthetised, Ian is now going to insert a tube down his throat so he can control Tim's breathing and bring his oxygen levels back up.
Have you got a bougie there? That's it. Thanks very much. OK, let's go. 24 at the teeth. OK, bougie out.
You got the tube?
I've got the tube. There we go.
Let's get that secured if you're happy.
OK, so ammo secure.
Right, we're ventilating nicely on that for now. SATs are coming up.
With the intubation successfully completed, the oxygen levels in Tim's blood are increasing.
OK, SATs come up to in the 90s, and he probably was hypoxic throughout all that.
Yeah.
It suggests that before Dr. Andy and Ian's intervention, Tim was hypoxic, meaning his breathing was impaired and his body was being starved of oxygen.
Right, OK.
Now ventilated, his condition should improve and the seizures will hopefully subside.
Right, should we get preparing to move? We'll be ready in a minute. Where's closest New Cross? Is that where he's known to?
He is, yeah.
Tim is now stable, but he urgently needs the full range of intensive care facilities that only a major hospital can provide.
Are you happy to go?
Yeah, thanks.
The nearest is New Cross Hospital in Wolverhampton.
Whiskey Romeo, it's Mike 98.
Ian updates the control desk.
42-year-old male, known epileptic, status epilepticus. When we arrived, crew had extricated one to the ambulance, still actively fitting. He's had buccal and IV benzodiazepines to nil effect. He's had a subsequent RSI with ketamine and rock. He's now intubated and ventilated. ETA about 12 minutes.
SATs are slowly creeping up, aren't they?
Yeah.
And turn his probe full up a bit because his blood pressure's just crept up.
Just pulling in.
Cheers, buddy.
Cheers.
Tim will be handed over to the intensive care team.
Yep, happy days.
Who'll closely monitor him over the next 24 hours. They'll also carry out tests to see if any damage has been caused to Tim's brain after such a prolonged seizure. In Hereford, the air ambulance is preparing to fly a mountain biker with a suspected brain injury to hospital. Dr. Richard Brown and critical care paramedic Kerry Hemus are also on scene.
Right, are we in?
He was wearing a helmet, but it split in two on impact. He's been put into an induced coma to reduce swelling in his brain and prevent a potentially fatal bleed.
How long have we got before we take off? 9:10, was it?
Because he can't breathe for himself, Dr. Richard will travel with him to manage his breathing.
Is that the last of your monitor now? Right, and then we just get the oxygen switched over. So from the oxygen cylinder into the wall.
Richard Brown, I'm one of the consultants on the Midlands Air Ambulance.
Before they take off, Dr. Richard provides the hospital trauma team with an update on the patient's condition.
We're bringing you a trauma patient by air, each hour approximately 25 minutes from now. It's a 37-year-old male who's come off his mountain bike at about 6:30 and was witnessed to be unconscious. He's got SATs in the high 90s, about 98 at the moment. Blood pressure's 136/82. When we take off, it's 16 minutes, but it'll probably take about 5-10 minutes before we're ready to lift, so approximately 25.
Kerry gives a final handover update as she won't be travelling in the helicopter.
Right, sorted. So he's on the monitor, oxygen's on, fluids are hanging, I'm not sure, they're not running. Pump is running, all good. BVM's there in case you need it, and the oxygen cylinder's onto the red. He's all connected, oxygen's on, fluids are up, all his numbers look good.
I'm happy if you are, yeah? Yeah.
Even on blue light, the journey by road to Bristol South Meads Hospital would take well over an hour. By air, Dr. Richard and the team will cover the 60 miles in just 30 minutes. Providing additional support to the ambulance crews are the critical care teams. Made up of doctors, paramedics and nurses, their advanced training and equipment means they can provide life-saving treatment on scene and en route to hospital.
30-year-old male, RTC, head injury, query pelvis, fractured right femur and lower limb fractures.
Established in 2018, every day on average, they respond to 20 of the most serious medical emergencies across the West Midlands.
It's nice and steady.
Tonight's team is made up of Dr. Adam Lowe and critical care paramedic Ian Locke.
Keep landing in the car.
In the early hours, while most people are still asleep, West Midlands Ambulance Service has already received nearly 600 calls for help.
Ambulance service, is the patient breathing?
Just about. He's slipping out of consciousness. He's lost about a litre of blood, cerebral fluid from a skull injury.
Is he very difficult to get to wake up at the moment?
Yes.
Please don't move him. OK, we are coming as quickly as we can.
The male of 69, fallen downstairs.
There you go.
It starts coming through as a cardiac arrest.
The patient has suffered a serious blow to the back of the head with significant blood loss. Dr. Adam and Ian are immediately dispatched.
Yeah, so we're going to a 69-year-old who's fallen top to bottom down the stairs. Complicating factor in this case is they're on a medication that thins the blood so they're less able to form a blood clot. So bleeding is an added component here.
An ambulance crew is currently treating the patient. After such a serious fall, there's a danger that he may have sustained internal injuries.
You can have both bleeding that's visible and internal bleeding, so that can potentially start to have an effect on heart rate and blood pressure.
If the patient has lost around a litre of blood, this could cause his blood pressure to drop, leading to unconsciousness and a potentially life-threatening cardiac arrest.
Operations manager estimates they've already lost between 500 mils to a litre of blood.
The patient lives on an isolated farm deep in the Shropshire countryside. When Dr. Adam and Ian arrive, he's being treated on the back of the ambulance.
Morning, guys. How you doing? You well?
Hello.
How's it going? Hey, how are you doing? Yeah, you all right?
Fallen down about 12 steps round a corner onto a slate floor.
Yeah.
69-year-old Peter used to work in the building trade. He was found by his wife at the bottom of the stairs. A neighbour called 999.
He doesn't remember how it happened. He doesn't know how he had ended up at one. He does know where he is now. He knows it's the day, week, month, everything like that. He's got 1 cannula in the right arm. He's had a gram of TXA, 10 milligrams of morphine.
As Peter is on blood-thinning medication, his condition is more serious. There's an increased risk of a bleed on the brain.
Hey, Peter. How you doing, my friend?
Peter needs emergency care in hospital fast.
Morning, Ryan, how are you?
Not too bad, thank you. Not too bad. Just to let you know, we're both here. We've got our drugs, so we're all yours.
Have a lovely day out in the sunshine.
Yeah, cheers, buddy. Have a nice day, guys, and we'll talk soon.
Clocking on are critical care paramedics Ryan Ferris and Mike Andrews. Ryan works an average of 4 shifts a week for the critical care team.
From a critical care paramedic perspective, I think we've got 31 CCPs, Mike?
31, I think there is.
31 CCPs, and then probably 25 to 30 doctors. So there's about 60 of us across the whole team. So I think in the grand scheme of things, it's a really small team. And yeah, it's just nice. It's a very different working way to when I was on the ambulances and you work on a hub where there's hundreds of people. You just never predicted the days you think is going to be busy turn out to be very quiet. The days you think you're going to have a chill day, not much going on, tend to be pretty manic. So I try not to predict anything anymore. Just see what happens, see what the day brings.
Ambulance service, is the patient breathing?
Yes, she is, yeah.
Is she conscious? Is she awake?
She's conscious, but she keeps falling into her sleep. She's 96 years old.
Okay.
That's my son.
Your son, okay.
She's not talking properly. She's not really with it, look. She was as a ghost.
I've got some help arranged. Don't worry, the ambulance is coming as quickly as possible.
When the ambulance crew arrived, they were so concerned about the patient's condition, they called for backup. Mike and Ryan have been dispatched.
So we're responding to an elderly female patient in the eastern part of Birmingham. So there's a crew on scene, so they've requested a bit of support. Sounds like they've got a bit of a difficult extrication from the house, and they're concerned that the patient's low blood pressure is sort of hampering that as well.
Extremely low blood pressure is a medical emergency. If there isn't enough blood flowing to the major organs, this can result in cardiac arrest.
I'm gonna go here.
When Mike and Ryan arrive, the patient's family are waiting outside.
Hello, mate. Hiya. Hello. Hi, sweet. My name's Mike. What can we do you for?
Basically, I is generally all well.
Okay.
Blood pressure, that's the best we've got it so far.
Okay.
We started, it was 61.53, so on and so on, and it's just gone lower.
The ambulance crew update Mike on 96-year-old Ada's condition.
She's had 700 ml of fluids.
Okay.
It's starting to get up now.
So in terms of medical history-wise, when did this all start?
Yesterday.
Yesterday?
Yeah, collapsed yesterday out of the wheelchair. Doctors gave her some antibiotics for the chest infection.
Okay, she got a good radial as she's lying there, mate?
Hasn't got a radial, no.
No radials at all? No. Okay. Hello, sweet pea. Can I borrow a wrist? Oh, you're absolutely exhausted, aren't you?
A strong radial pulse shows the heart is working well, pumping blood around the body. Ada's radial pulse is undetectable. This could be a sign that her body has been weakened fighting the chest infection.
Ada?
Ada, stick your tongue out for me. Stick your tongue out if you can. Can you stick your tongue out for me? You are absolutely worn out, aren't you? Are you still coughing stuff up, Ada?
Ada needs treatment in hospital, but with such low blood pressure, just the effort of moving her downstairs could send her into cardiac arrest.
How long has it been that you've been feeling this terrible?
A few days.
A few days. All right. I'm going to have a quick listen to your chest.
Do you know where you are now, Peter? Excellent.
On a farm in the Shropshire countryside, Dr. Adam Lowe and critical care paramedic Ian Locke are with 69-year-old Peter. He suffered a serious head injury after falling down some steps onto a slate floor.
Pool of blood under there, yeah. Right humeral fracture as well, do you see?
As well as the injury to his head, there's a suspicion that Peter has broken a bone in his upper arm.
Pain in the shoulder area. Upper arm.
Actually, it's still bleeding, actually, isn't it?
Peter takes blood-thinning medication. This lowers the risk of a stroke, but it also reduces the blood's ability to clot.
How are you feeling from a pain point of view?
He's had one.
Apart from your shoulder, okay. Is it manageable because you've had 10 of morphine?
10
Yep.
morphine.
Yeah. Okay, all right. We'll keep an eye on it. If it gets worse, do let us know, Peter, okay? And we can give you some more pain relief, all right?
Peter needs a CT scan to see what damage has been done to his skull. On the way to hospital, Dr. Adam and Ian travel with Peter to provide ongoing critical care.
You're still bleeding quite briskly from the back of your head. Okay, so I'm going to try and put a tighter bandage. Okay, the aim of that is to stop the bleeding. Disadvantage is going to feel a bit tight around the back of your head, but it's something I think I need to do. Can you just wiggle your toes before I do that? Good man. Okay, and wiggle your fingers. So both feel fairly normal on both sides. Sorts of good. Okay.
Dr. Adam asks Peter to move his fingers and toes. He wants to make sure his head injury isn't affecting the neurological signals from the brain. Any interference or damage could cause paralysis.
Do you mind just supporting his head slightly up for me? And I'm going to try and get a bit of tension on it.
Peter, you just feel me just supporting your head upwards a little bit, okay?
If anything we do, Peter, hurts or makes your arms or legs feel weird, just tell us to stop, okay? Does your head feel reasonably comfortable in that position, or do you want us to try and get a blanket or something underneath just to get something? Yeah, okay. Something that's not white, basically.
So far, Peter has remained conscious and able to understand what's happening to him.
We're taking you to the Queen Elizabeth Hospital in Birmingham. Okay. The reason for that is we're worried that there might be a break in the bone at the back of your head. Okay. Okay, which you've smacked on the floor as you've come down the stairs. Okay. The second confounding factor is that you're on a Pixaban and you're still bleeding. Okay.
The team arrive at Birmingham's Queen Elizabeth Hospital, where medical staff will work to stop Peter's bleed and scan his head to determine the extent of his injuries.
Despite us putting another pressure dressing on the back of his head, he was still bleeding through that. So he's lost a fair bit of blood and continuing to lose it. Hopefully Peter's prognosis will be good and he'll remain nice and stable. But by bringing him to this hospital, he's got access to neurosurgery if he needs it.
One of them. One of them.
That's got the coffee in it, this one.
Good.
I invested in an AeroPress. Oh, what a difference.
Preparing the day ahead is critical care paramedic Richard Apps and paramedic Ben Reen. Ben is currently training to be a critical care paramedic, whilst Richard has worked on the team for the past 10 years.
I've got everything I need.
Nice to see you too.
Yeah. Thanks.
Right.
Let's do one.
Fortified with caffeine, they head out on shift.
Ambulance service, is the patient breathing?
Yes, basically I've got RTA with the little one. He's giving me no notice whatsoever. He's running between the cars and he's just come right in front of me.
So one child has run across the road?
Yeah, basically what it is, I don't know, he's managed to open the door and he's basically run across the road, and as I was going past, he's run out on me and I've ended up running him over.
Okay, how old is he roughly?
Very young, I'd say probably 3-4 years old.
Okay, is he bleeding from anywhere?
Yeah, he's bleeding.
Where is he bleeding from?
From his head.
So the ambulance has been arranged. It's the nearest vehicle, blue lights and sirens. They are going to be there extremely soon.
A child has been run over and could have potentially life-threatening injuries.
6-2.
16, thank you. Can I start you guys towards Witten, please? It's a 3-year-old versus car. Considers head injury, but no other details currently.
Richard and Ben are immediately dispatched.
Yeah, no worries, thanks, mate.
Thank you, anyway.
There were over 10,500 children killed or injured on Britain's roads in the last 12 months.
Children are the hardest jobs to go to, especially when you have children that are 3 yourself. Try not to relate it to your own lifestyle and your own situation, but it's very tricky not to.
The critical care team has been dispatched because the boys reported to have a head injury.
Head injuries are always quite hard because they can deteriorate quite quickly. So to have those additional skill sets and experience is really important on a job like this.
So, just a quick update. Was hit by a stick lorry.
Oh.
It's got quite a few sort of bruises, I think. Due to the fact that he was hit by a lorry, they'd like to keep you running.
How do you feel now you're sitting up? Just tired out. I'm not surprised.
In Birmingham, critical care paramedics Mike Andrews and Ryan Ferris are with 96-year-old Ada, who had collapsed and has extremely low blood pressure.
So we're just checking your blood pressure again, Ada. To be fair, if we have a bit of a sudden drop, then we'll metramine it if it doesn't. If you're happy with it, we'll just help you out with the lifting and carrying.
Ada's blood pressure is so low, just moving her risks her going into cardiac arrest.
Are you feeling now okay? Yeah, all right, okay. Have a rest, why don't you? I think we'll just go with chair then, if that's all right, guys.
She's got a heart rate of 101 and a systolic 59 with a map of 48. And BP cycling at 3 minutes.
Mike gives Ada metaraminol, a drug which restricts the blood vessels and helps raise blood pressure.
Okay, well, look. 15:59, that went in.
If they're to have any chance of getting Ada downstairs, they need to get her blood pressure up.
6-2.
6-2, go ahead.
Thank you, Pete. Just an update on scene. This lady sounds like a chest sepsis etiology. Currently hypotensive at 50 systolic when sat upright, despite almost 750 mils of fluid.
Ryan is concerned Ada may be suffering from sepsis. This is the body's extreme response to an infection. Over 50,000 people die from it every year in the UK, and it requires emergency treatment in hospital.
We're going to give her some small boluses of metaraminol to see if she's got some response to that, and try and extricate her from the property. So once she is extricated, we'll give you a further update. Well received.
How you feeling now, Ada? Okay, chick, you're so tired out, aren't you?
Tired, yeah.
Let's do the blood pressure and see where we're at.
I'll speak to family, Mike, I think.
Yeah,
There's one less in the room as well for her, isn't it, bless her?
Ryan explains Ada's condition to her granddaughter, Sally.
Hi there. Hello, Pop. Is he going to maul me, is he?
He's fine.
He's fine. So at the minute, we're just giving Nan some medication just to try and support her blood pressure, OK? So we want to try and get her blood pressure to a level we're all comfortable with before we try and bring her down the stairs, OK? Just to try and avoid any adverse effects. But we'll keep you updated, but we should have Nan down fairly soon, all right?
I think we might end up either giving adrenaline or going on scoop.
77.51.
Blood pressure? 77. Okay. How you feeling now?
Just trying to go and do what they're doing.
Oh, no. I think mentation-wise, she's waking up a little bit, isn't she? She's a bit more chatter. So, cheers, buddy. Thank you.
I'll just set up another bag of fluids and we can use it as a flush, and then if she needs a bit of a bolus as well.
OK, mate. I think, to be fair, we're probably in the realms of just giving it a go now, to be fair. So, we'll go for the chair.
Now take these leaves off, you know, my darling.
I'm going to leave the cuff on your arm, though. That's it. We'll see how we go without the O2. Let's just take this off you for a second. There you go. Lovely. That seems to be running beautifully.
With Ada's blood pressure showing signs of improvement, the team can start the difficult process of moving her downstairs to the ambulance.
No.
Get your sea legs. So what we're going to ask you to do, pop that foot on the floor, if you can manage to. Yeah. Slide your bum around and stand up with us.
Hold on to the back of my elbow, Ada.
There you go. Nice and gently, OK? Gentle little stand up.
Come on, my sweetie, well done. Good girl.
And spin yourself round. This is like dancing, but I'm no good at dancing. OK, Ada?
No, I ain't.
You're better than me, I bet. Can you walk towards me just a touch? OK. Are we in a position to sit down? There you go.
Oh, God.
Well done. Well done.
Because the stairs are narrow, they are using the carry chair rather than the stretcher.
You're going to be sick, OK. We've got a bag here if you need to be sick, all right?
The chest infection is causing Ada's breathing to become laboured, and the effort of moving is making her feel nauseous.
Can you stand up with us, Ada?
Ada, just that's it.
There you go. Hold on to there, and I'll help you on your arm.
The next stage is to transfer Ada from the chair onto her stair lift.
Nice and gently. There you go. There you go.
My darling.
Well done. If you spin round towards me.
That's it. Keep going, Ada.
Well done.
Oh, God.
That's it.
There you go.
Lean forward for me.
1, 2, 3.
And I've got you.
There you go. Little wiggle. Well done, mate.
There you go, little shimmy.
How you feeling there, chick?
Oh, I'm terrible.
Feel terrible. Come around that side of me.
Go, your granddaughter's here, Ada.
There you go.
I've put your few things in there. Your slipper things are in your bag, and your phone, and your charger.
It's all right. It's okay. Oh, you're okay. Don't worry. Yeah?
You will come out.
You will be, my darling. We'll get over this hump and we'll get you back home again, OK?
Right.
Following you up anyway.
So we're going to Heartland, chick, okay?
Yeah.
So she'll be an ED. Okie doke. We'll see how we're going. All right, mate, nice one.
See you at Heartlands.
Yeah, see you there, mate.
It's only a 3-mile journey to Heartlands Hospital. Mike travels with Ada so he can administer more medication if needs be.
Let's just have a quick feel of your wrist, Ada. Do you have any pains anywhere now, Ada? No pain. You feel worse now.
You feeling sick?
What is it, love? You're feeling a bit sick. Let me know if you're going to be sick, and I've got a bowl here for you.
Although Ada's vital signs have improved, she remains in a serious condition.
You still feel sick? I'll sort that out at the hospital for you, darling.
Take this off.
Just putting in now.
Right, your end. Try and keep your arm on your lap if you can, chick.
Looks like they're in the house.
In Birmingham, critical care paramedic Richard Apps and paramedic Ben Reen are arriving at the house of a toddler who ran into the road and was struck by a lorry.
From what we can see, the only obvious injuries he's got is just to his face. Parents don't speak English, so it's kind of hard.
Three-year-old Hassan has visible lacerations to his face. From experience, Ben and Rich know he may also have internal injuries that could be life-threatening.
Hello, what's your name?
He seems okay, to be honest. Obs are all right.
Yeah.
He's had some currency involved.
Yeah.
Ben and Rich are updated by the ambulance crew who arrive first.
There's been no wincing, there's no deformities. Had a good feel down his arms and legs, there's nothing obvious. He's just got the facial wounds.
Has he walked?
No,
Or not?
He's been moving around, he's kicked out at me and stuff.
Yeah.
Thankfully, Hassan appears to have escaped with only minor injuries.
Hello, what's your name?
Have you got anybody that speaks English? No.
No.
But the language barrier is making it hard to carry out a proper assessment.
Yeah, if we go down to the children's and we'll put an alert in just because of the mechanism, because he's fine now, but we don't know, do we?
No.
Hassan will need to be taken to the children's hospital for a checkup.
Yeah, still needs to go hospital. Needs hospital. Yes.
Yes. Have you got shoes? Do you want to put some shoes on?
Shoes.
You need to come now.
Even though Hassan appears to have had a lucky escape, Ben and Rich want to be sure he's okay.
You get some shoes and let's get to hospital.
Okay, little man.
6-2.
6-2, go ahead.
Rich updates the control desk.
Just going to do a quick off-scene straight to children's. He's GCS 15, but as you can hear...
Yeah, roger, no problem.
We need to take him to hospital.
Tiene miedo.
We've got sats of 100 and a pulse 120, temperature 37.8 and GCS 15. I'll just check with them, but I think the crew will be happy on their own.
Yeah.
Yeah, lovely, that's all copy. Thanks, mate. I'll pump them in at 8:25.
Cool.
Confident that he's in no immediate danger, Rich and Ben leave Hassan with the ambulance crew to be taken to Birmingham Children's Hospital for a thorough assessment.
Difficulty here is we've had a language barrier, so it's really hard for us to actually gauge from the mum how poorly the child is to her. But just from our observations, they're all within normal parameters, which is great, and no big obvious scary injuries, so a really lucky outcome from what we can gather. Very lucky.